Okay, the rest of the arterial flow through the abdomen. So in the second picture, they have removed the everything that the celiac trunk supplies, so that you can sort of see what's left under there. So that's the celiac trunk up there, and then the next big branch that you can see both right here and this guy right here is called the superior mesenteric artery because it goes through the mesentery and it's the top one. The superior mesenteric artery supplies a lot of what's missing in this picture. It supplies the small intestine that we didn't take care of already because remember we got the duodenum already. So it supplies the rest of the small intestine, and then it supplies the first two portions of the colon. And you might not know those portions yet, but this is the ascending colon and this is the transverse colon. So notice that this branch supplies most of that. And then it actually forms an anastomosis with the other one. So that is the superior mesenteric arteries. The rest of the small intestine, the ascending and the transverse colon. And then the other branches that come off here, let's pick those up real quick, are the renal arteries, left and right, the suprarenal arteries that go to the suprarenal or adrenal glands, left and right, and those have some weird branching patterns. Don't worry about it too much. Then these guys right here are the left and right gonadal arteries, which, as I mentioned before, would be testicular or ovarian if you knew this sex. And then the next big branch is this guy right down here, which is called the inferior mesenteric artery. And the inferior mesenteric artery is also pictured here. So inferior mesenteric artery, what it does is supplies the rest of the colon that we didn't supply before, and also the rectum. So notice where it's going. This is called the descending colon, and this is the sigmoid colon, and it also supplies the rectum. Okay, so let's look at these branches in a couple of different ways. So if we have most of the guts cut off, this is the celiac trunk, the superior mesenteric artery, and then the inferior mesenteric artery. To reiterate, the celiac trunk supplies the stomach, the liver, the spleen, and the duodenum. The superior mesenteric artery supplies the rest of the small intestine and the first two parts of the large intestine, ascending and transverse colon. The inferior mesenteric artery supplies the rest of the large intestine and the rectum, the descending and sigmoid colon and the rectum. Okay, and then the only other things that are in this picture are the left and right renal arteries, the left and right suprarenal arteries, and then the left and right gonadal arteries. Okay, and now venous drainage of the abdomen. The venous drainage of the abdomen is a little weird. It's not what you would expect it to be. There are some things that are kind of what you would expect them. Left and right renal veins, okay, those are good. Those both dump directly into the inferior vena cava. The left and right suprarenal veins usually dump wherever the heck they want. They can dump into the inferior vena cava, but they also often dump into the renal veins. The right gonadal vein usually dumps into the inferior vena cava, but the left gonadal vein usually dumps into the renal vein for reasons that just evolved that way. But then notice you don't have any superior inferior mesenteric veins in this picture. And that is because the venous drainage of the abdomen uses a strange circulation pattern because you need for all of that blood that was absorbed from the intestine to go through the liver before it goes back into circulation, because the things that we eat are not sterile. There are potentially funky pathogens and toxins in there. And what has to happen is I need to gather all of that blood up, and I need to send it through the liver. Those big sinusoid capillaries in the liver will have surveillance on the blood that's going through and take out toxins and pathogens before you dump it back into the inferior vena cava. So this is a strange flow pattern, but I can explain to you why it exists, and hopefully it will make more sense to you. So generally speaking, what doesn't happen is you are not going to have, generally speaking, circulation patterns go heart, arteries, arterioles, capillaries, venules, veins, heart, right? This situation, what you're doing is you're going heart, arteries, arterioles, capillary, a portal vessel that goes between two capillary beds, and then a second set of capillaries. So you put 2 capillary beds in series, and then those go venules, veins, heart. So this is called the hepatic portal system. And the hepatic portal system gathers all of the blood up from the intestines and a couple of other organs, and then sends it through the liver from the bottom to the top before it goes back into circulation. And the liver has a chance to do surveillance and take out any funky stuff. So the liver, remember, now this is strange because the liver also receives blood from the celiac trunk, remember, the hepatic artery proper. So the liver is getting arterial blood that's high oxygen, but it's also receiving low oxygen venous blood. And what happens inside the liver is those capillaries mix the high and low oxygen blood and the high and low nutrient blood and the high and low pathogen blood. And it slowly goes through those capillary beds, those sinusoid capillaries, and the liver takes all of the pathogens and as much oxygen as it needs. And then when it's done with it, the blood goes back into the inferior vena cava. So let's go ahead and draw this one in. Let you guys practice with it a little bit. Okay, so what's going to happen with hepatic portal circulation is I am going to gather blood up from the spleen, a little bit from stomach, although we don't know those or learn those. This small intestine, the large intestine, and all of that blood is going to gather together to go into the hepatic portal system. So let's see how it is in your notes. Okay, so let me show you what it's doing. All right, so do you see a chair here? Do you see that chair? Okay, keep your eye on that chair because I'm going to say front leg and back leg. So the first one that we're going to run into is this guy right here. And notice where it's coming from. This guy is coming from the descending colon and sigmoid colon, and blood is going up. Let me draw that better. It was all shaky. Blood is going up. So that vessel is the inferior mesenteric vein because the blood is coming from the descending and sigmoid colon. That's the inferior mesenteric vein. The direction of blood flow is how the arrow is going and also how I drew it. Then I'm going to take blood from the spleen. That one. That's the splenic vein. Then the back leg of the chair is going to gather blood from most of the small intestine and the proximal portions of the large intestine, and that is called the superior mesenteric vein. When all 3 of those vessels come together, they gather in this huge, huge vein right here, and that is called the hepatic portal vein. And so what it's doing is it's taking all of the blood from those capillary beds of the small intestine, large intestine, and spleen, and it's going to push that blood into the liver. And then again, the blood is going to go slowly percolate through the capillaries of the liver. And then when it's done and clean, it's going to get dumped into these 2 vessels that are at the top of the liver. Those are called the hepatic veins, not portal veins, hepatic veins. And then the hepatic veins will dump into the inferior vena cava. And so what is the point of all of this? The point of all of this is all of this blood is being cleansed and monitored before it goes into circulation at large, because the blood that is coming from those intestines is not necessarily clean. And I'll explain to you why the spleen is involved in that process in class. So the hepatic portal system is this. I always ask about it on the test, so definitely get used to looking at that one. Okay, so we'll stop that, and then I'll do pelvis and